It's an honor to be here with you today because I have seen the volunteers work in both Apollo and now continuing at Aster. It's a very difficult and tough job. I just jotted down few points so that I don't miss out anything. God gave us 2 ears and 1 mouth so that we listen more and talk less. But we do the other way around. We hardly listen. You can see in any conversation, hardly the opposite person would be listening, or he would be making his mind to reply, what to reply to the person who is talking. So hardly anybody would be listening. And what patients want, especially in cancer or any other field for that matter, is someone to listen to them. Nobody listens. In fact, doctors, we are so busy in doing rounds, and we are so busy in the workup of the patient, diagnosis, then the investigations, whether they are normal or not, the toxicities of chemotherapy, the survival. We are bogged by these matters and we hardly listen to them. And sisters nowadays, because of NABH and JCA and all, they are bogged by the paperwork. They keep on writing so many things there, whether they eat idli, upma or not. And I tell them, don't write all those things, you can fill it up later, but just talk to them first. And also residents are more busy in reviewing the literature and doing their research work or thesis work. So hardly anybody listens to the patients. So there, I saw the huge need for that, to somebody to listen to the patients. I try as much as possible, but when Alpa came to Apollo, she was in helping hands that time. You know how corporates work. Corporates always have this timelines and then their targets and monthly things and all, but hardly they encourage anybody. But then we made it very clear that they will enter Apollo and they do their work, and we told them it's completely free of cost, so they were very happy. So it's free of cost, so they allowed them to work. And then other consultants had this fear whether they will take the cases from them and give it to me. So those apprehensions they had. So we had to iron out so many things because it's not a government hospital or a charitable hospital. So there the individual practice is there. So but we ironed out all those things, and we used to have monthly, weekly meetings where I used to talk and Alpa used to talk and Sir used to talk there. And then other consultants used to come and talk, and then we gave assurance to all the consultants that their case would not be taken away from them. So it was a very good experience, and then we have extended the same support at Aster. There was a lot of red tapeism in Aster to enter for volunteers. Now we have removed all those things, and great work is being done in all the Aster branches except for Aster Whitefield, which we are going to extend shortly with Alpa's help. They have been doing a tremendous work, and what they do is true karma yoga, what is described in Bhagavad Gita. We all talk theories, but we hardly do it in practice. That is a nishkama karma, without any motive, or without, that is the selfless work you people are doing. It's a great job. And Sir Kishore Rao sir is there, who has started Karunashra. We all know what great work Karunashra is doing in the city. For so many patients, we just give a letter and refer to them, but it's very difficult to take care of terminally ill patients. Palliative care is very, very tough job. It's not like curative setting of lymphoma, leukemia, where we tell good prognosis, but it's very, very difficult when it comes to pancreatic cancer, gallbladder cancer, and advanced lung cancer, breast cancer, and all. It's a very tough job. To listen to them and give counseling to them and support them. And as Cedric mentioned, we contribute only 20% or less than that. The most is by their willpower and the support what they get from the family and the society and the psychological support, everything, financial support, everything counts. It's not only the treatment which matters. So that's what I would like to say. That is the nishkama karma they are doing without any without having any self motive. They are doing a selfless job. All of you know that, and you are doing that. You're doing a great job. What I do is I do it for a salary. I don't, and I hardly do any charity. But you people are doing it daily, every day, and you're going to talk. You're going to them and talking to them and listening to their. And many patients, most of them are not welcoming because they feel somebody else is coming, and so all of a sudden they're introducing themselves and speaking to them. And also clearly, Alpa told us before only that they'll not be talking about stage or prognosis, so many things, because invariably patients tend to ask that, what is my prognosis? So nowadays we get a lot of charity in terms of money and all, but we hardly get anybody who gives time to patients. It is said that Shateshu Jayate Shuraha, Sahasreshu Cha Panditaha, Vakta Shatasahasreshu, Data Bhavati Vanava. Shateshu Jayate Shuraha, there may be a one brave man among 100 people. Sahasreshu Cha Panditaha, one scholar among 1,000 people. Vakta Shatasahasreshu, a good speaker among 100,000 people, that is 1 lakh people. Data Bhavati Vanavaha. But a giver may or may not be born. So giver in the sense, it's not only money, it's the time which is most important. We hardly have any time today. in this world of WhatsApp and Facebook and Instagram and whatnot. There are so many things to divulge, but hardly anybody gives time to somebody else. So that time is being given by you people, so hats off to you. And then what patients require, what I have realized is, see, it's very easy to diagnose and stage the cancer. Nowadays, it's not very difficult. And treatment also is protocol driven. It is all standard. What is given in Michigan is given in Mangalore or Bangalore. The same R-CHOP is given, same BR is given, same FAC or whatever chemotherapy is given. So but what matters is the friend and the companion. So that is what you people are doing. Hardly the doctors and sisters don't do that, PGs don't do that, but you people are doing that. So what a person or a human being requires is a companion. End of the day, they don't want to listen to all our jargons and all, because they are already bogged down with the diagnosis, which is the most dreaded diagnosis anybody can have in their lifetime, that is cancer. So ಕಾರಿರುಳ ಆಗಸದಿ ತಾರೆ ನೂರಿದ್ದರೇನು ದಾರಿಗನ ಕಣ್ಗೆ ಬೇಕೊಂದು ಮನೆ ಬೆಳಕು ದೂರದ ದೈವವಂತಿರಲಿ ಮಾನುಷ ಸಕನ ಕೋರುವುದು ಬಡ ಜೀವ ಮಂಕುತಿಮ್ಮ. Means in the dark path, ಕಾರಿರುಳ ಆಗಸದಿ ತಾರೆ ನೂರಿದ್ದರೇನು, there may be many stars in the sky, but what is important for a person who is walking on the lane is the lamp post or a lamp from a distant house. So ಕಾರಿರುಳು ಆಗಸದಿ ತಾರೆ ನೂರಿದ್ದರೇನು ದಾರಿಗನ ಕಣ್ಗೆ ಬೇಕೊಂದು ಮನೆ ಬೆಳಕು ದೂರದ ದೈವವಂತಿದ್ದರೇನು, there may be or may not be God, we can discuss throughout the day. ದೂರದ ದೈವವಂತಿದ್ದರೇನು ಮಾನುಷ ಸಖನ ಕೋರುವುದು ಬಡ ಜೀವ ಮಂಕುತಮ್ಮ. So ಮಾನುಷ ಸಖ, what human being wants is a companion. That's what you people are doing, so hats off to you. I'll not take much time. So thank you, and please continue to support us, and I'll also continue to support you. Thank you so much.